Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight, where we're going to talk about Lyme disease. I look forward to seeing what questions you have tonight, and wondering if we'll get into some themes as we sometimes do. For those of you that are new, welcome here. And I'm glad to see a number of familiar faces and names back again. Well, not faces, but names. All I can see is names on my message board. The way that you participate is two ways. Number one, you can listen to the questions as I read them and the responses that I give. Second way is to write a question to me. And the way to do that is to, in that chat box area on the bottom of your screen on the right-hand side, there is a question mark. Click on that and then write your question there, okay? I'm trying to get everyone to use the question mark to send their questions to me. It's a better format for me to work with from my side, so I request you do it that way. I am creating a recording of tonight's webinar, and sometime tomorrow morning, we're usually by 9:30 in the morning, I do send out an email announcing that the recording is ready. To get it ready, I do a brief edit of it, and then I also create a summary about what we talked about. So you can look at that and see if there's parts of it that you want to go back and look at again or not. This is going to be my last webinar for this month. I actually had one scheduled for next week, but I realized I have a scheduling conflict. So I'm not going to be able to do next Thursday's webinar, nor the week after that. So this is the last webinar for a few weeks now, but I will be back again with you in March and do those again. So in tomorrow morning's email that I send out announcing that the recording is ready for you to see, I will also have links that you can sign up for the next series of webinars in March. All right? All right. I think that takes care of all the business ends of things here. So without any further ado, let's go ahead and get started. And first of all, I'm glad. Thank you, everyone. I see that most of you are putting your questions to me by pressing on that question mark. I appreciate you following and doing that. Thank you. All right, let's go ahead and get started here. Hello, Catherine. Let's see. Hello, Dr. Ross. I've been treated for Bartonella and Borrelia and have significant improvement with joint pain and memory. However, now I am waking up at 3 a.m. with an adrenaline surge, elevated heart rate, and blood pressure, becoming anxious and cannot get back to sleep. Also, my feet get a burning sensation. This lasts for about 1 to 1.5 hours. Then everything settles down and I go back to sleep. Any thoughts on what could be causing this? And if so, how would you treat it? Huh, interesting. You know, I'm not sure why this is happening. The one thing I can think of is it is possible that you could be getting adrenaline surge if you're becoming hypoglycemic in the evening. So you're developing low sugar. I have seen that happen before, but that would be about my only thought. One thing you might want to experiment with is having, before you go to bed at night, having a protein snack. And that could be, it could be any kind of nuts like almonds, any kind of nuts, okay? Because they're going to be rich in protein and fat. And you can just take a handful of those, have them before bed. And having protein can sometimes balance out your insulin so that you don't develop low sugar in the middle of the night. That would be one thing to think about. I can't guarantee it's going to make a difference for you, but if you were my patient and had something similar to this, that's probably where I would start with things, okay? Anyhow, good luck with that. Thanks for the question, Catherine. Hello, Megan. Let's see. Hi, Dr. Ross. I have been on antibiotics or herbal antimicrobials for 4.5 years, fighting Lyme and Bartonella. Through checking arabinose, I know yeast is not a major problem for me, but my overall stiffness, joint pain continues to get worse. I am fighting my germs well. I just wonder if part of what I'm experiencing is the systemic inflammation due to a gut microbiota that is totally messed up. My question is, do people in your practice stay on antibiotics this long but still come out the other side and recover to live a pain-free, well-balanced life in spite of so much ongoing assault to the microflora? I am on 2 billion CFU per day, but my gut still is taking a hit, and I just hope what I think is Lyme isn't just chronic inflammation process stemming from my gut. Thoughts? Thanks. All right. Megan, So, you know, I have a number of people in my practice over the years that have been on years of antibiotics that we do eventually get them off the antibiotics and they get on their way with their health again. Okay. So, most people, even though antibiotics are not good for the bacteria in the gut, most people recover fine from it. Now, it's true that your bacteria balance in the gut may never get back to normal. If we look at studies that have been done in the gut microbiota, it just 10 days of antibiotics, even 3 or 4 years down the road, still results in disturbances of the healthy bacteria that make up the gut. Okay, just 10 days of antibiotics, okay? But when you've got Lyme, you've got to weigh out the risk of not doing anything to kill your germs versus the risk that can occur to the gut microbiota. That's what you're weighing out, all right? Now, a note about arabinose. So arabinose, everyone, is an organic acid that is made by yeast. And if you have yeast overgrowth, often, you notice the word I said, often, you are going to have increased arabinose, okay? And the way you test to see if you have arabinose is there's a Great Plains lab here in the States does a test called a microbial organic acid test, also known as a MOAT test. And you pee, and then we measure how much of a variety of different organic acids you have, okay? Now, in terms of does arabinose always pick up intestinal yeast? No, it may miss it sometimes, okay? Now, if you do have an elevated arabinose on your MOAT test, it does mean you have too many yeast, but it may miss it, okay? So my question for you that you ought to still consider is, could you have too many yeast? And if you have a variety of symptoms suggesting it, then you might, okay? So symptoms that suggest yeast overgrowth include intestinal gasiness and bloating, increased sugar cravings, doing worse after you have something that's sugary, meaning you get more fatigue or more body pain, having increased skin rashes or getting pimples and acne sometimes can occur as a result of yeast in your intestines. Part of that is due to yeast releasing toxins that get into your bloodstream and interact with your skin, leading to these problems, okay? Also, other signs of intestinal yeast overgrowth can be vaginal itching, vaginal discharge in a woman. And then sometimes you can get yeast even up here in your food pipe, and it'll make it feel like things get stuck or it hurts as you're swallowing down, okay? So those are things to think about, okay? And if somebody's got enough of those going on, even with a negative arabinose, I would treat for intestinal yeast overgrowth, all right? The other thing you could do to look and see, do you have a lot of dysfunctional bacteria or dysfunctional gut health, would be to do a study of something called a comprehensive GI profile. So Genova Diagnostics does that. Great Plains Lab does that. Doctors Data has a lab that does that. And what you're doing with these comprehensive GI profiles is they're taking a snapshot of your bacteria to see what's there, okay? They're also looking to see some markers like something called beta-glucuronidase. And if that is elevated, it means that you have dysfunctional bacteria in your gut, okay? There also will be doing studies to look at, they'll measure a chemical in there called calprotectin, which measures, do you have inflammation of your intestines that we might see with inflammatory bowel diseases like Crohn's disease and like ulcerative colitis, all right? And finally, there will be markers in there, chemical markers in that test that will tell us whether your pancreas is working correctly or not. And for the pancreas to work correctly, it needs to get signals from the healthy bacteria and healthy skin that lines your intestines as well, too, okay? So, you know, if you're having a lot of GI dysfunction, your arabinose is negative, if you have a lot of yeast symptoms, I still would treat, okay? But if you don't have a lot of yeast symptoms, to get a better sense of what's going on in your gut, I would look at doing that comprehensive stool analysis. That's what I wind up doing with my patients to give me some ideas about whether we have how bad of a gut imbalance we may have with the bacteria that is there, okay? But to answer your question, can you still recover and get pain-free and have good energy even with dysbiosis or imbalance of the good bacteria in your gut? The answer is yeah. I have plenty of people that have, okay? All right. Good luck to you, Megan. Okay, so for those of you that are leaving me questions and not clicking on the question mark before you enter the chat box, please don't do it that way. Send me your questions only after you click on the question mark in the chat box area, then write your question, okay? So I'm going to move a few of these questions over so that I can see them. So bear with me here for a minute. But generally, you're all doing well. So just 3 people that did it that way. So I'm just reminding you, before you write your question, click on that question mark, okay? All right, thank you, everyone. All right, let's go back here. Hello, Sita. Dear Doc, please talk about tonsil stones and why they appear and how to handle them. This started last year-ish. Is this common in vector-borne infections? On a different note, did you check out the root cause protocol? Okay, so regarding tonsil stones, I don't see that they occur with any increased frequency in people that have tick-borne illnesses than people that do not, okay? So I'm a family practice doctor by training, and prior to managing Lyme disease beginning back in 2004, I guess 2004, most of my practice was just dealing with garden variety stuff, and every now and then somebody would come in with tonsil stones. And so, but I probably have, since I've been managing Lyme disease exclusively, I just don't see anyone that has tonsil stones. As to how to handle them, if I've got people that are having recurrent ones, I usually would just send them off to the ear, nose, and throat doctor and have them help manage that, okay? In terms of this root cause protocol, I briefly took a look at it. And the theory is if you work with some essential minerals and micronutrients, that at least my take on it was that if you start some essential micronutrients and minerals, that could help you heal and recover from various illnesses. Maybe it will make a difference for people with Lyme, but I'm very skeptical because ultimately Lyme is not about a micronutrient issue. And even giving micronutrients is not going to be enough to get your immune system working well to take care of these infections. I'm kind of skeptical that it would make, from what I read, that it would make much of a difference. Anyhow, thanks for your question, Sita. Hello, Lynn. Let's see. Hi, Dr. Ross. Last week you mentioned a patient of yours who had resolution of widespread body pain after 3 months on BPC 157. Can you say more about what dosage they were on and how you titrated them up? Also, did they suddenly see improvement after 3 months, or was there a gradual improvement leading up to that point? So Lynn, I don't remember specifically enough her story other than after 3 months, she did have we had a visit and she was remarkably better. I can't remember from talking with her whether this is something that happened gradually or not. In terms of the dosage that I did with her, it was just 1 pill twice a day. So it was on the lower side. And as many of you know, sometimes you can dose all the way up to 3 pills twice a day. The way that I've been working with it is I'm having people dose at 1 pill twice a day. And I'm advising them that if they have some, that after a month, if they have had, if they're not getting improvement, that they then go up to 2 pills twice a day. And in another month, if they're not getting enough improvement, then go up to 3 pills. Now, I know that other people are, using this much more aggressively than I am. I'm still learning how to work with it, but that's kind of the approach that I've been using in my practice. Okay. Good luck, Lynn. Hello, Dave. Let's see. Hi, Dr. Ross. Do you have any mold doctors that you recommend here in California? We have a hard time finding mold doctors, and Real Time Labs recommends Environmental Health Center in Richardson, Texas, which is obviously difficult for us to go and see since we are in California. Thanks. So, Dave, basically, most doctors these days that manage chronic Lyme disease are probably going to be managing chronic mold along with that. Doctors that I like, that I know do a good job with this in California, most of the ones that I would look at are in Northern California, actually. So you might consider Gordon Medical with Dr. Eric Gordon. You might consider Frontier, I guess it's called Frontier Medicine or Frontier Health with Dr. Steve Harris, which is down around Palo Alto area. It's one of the small cities down around Palo Alto. Dr. Gordon is up in Santa Rosa, California. And then yeah, those are some thoughts. There are some other people down there doing it. I'm just blanking off the top of my head. Okay. All right. Good luck to you, Dave. Dave, I mean, those are two names I would be aware of, but you might also reach out to ilads.org, and ask them who are Lyme literate medical doctors around where you are. Because again, most of us these days that are managing chronic Lyme disease are also managing mold toxicity as part of what we do. Okay. All right. Good luck to you. Hello, Dave again. Let's see. Hello, Dr. Ross. Have you ever used or have read any literature of using viagra or cialis to improve blood flow? My wife's Lyme doctor is considering putting her on low-dose cialis to help with blood flow. We have never heard of this before. Thoughts? Nope. I haven't seen anyone try to use that in terms of managing Lyme disease. So the answer is no. And I'm not quite sure why they think it's going to help, because that's not what it's designed or the mechanism by which it works too. So anyhow, yeah, thanks, Dave. Hello, let's see, Dig. I'm not quite sure how to say your name. Is it Dager or Dager? So hello, I'm sorry if I botched that up. Let's see, I was diagnosed with Lyme 1 month ago, diagnosed due to bacteria seen in dark field microscopy. My symptoms are brain fog, tiredness, anxiety, muscle twitching, and little balance problem. These are the drugs given for my treatment. Do you think these drugs and supplements are enough? Thank you. The antibiotics Flagyl, 3 tablets a day, 7 days a month. 1,000 milligrams every day of minocycline. I think you probably mean 100 milligrams. 50 milligrams 3 days a week. Other supplements, cat's claw, garlic, B12, D, K, magnesium, artichoke, bentonite clay. So it's hard for me to say if that's an appropriate treatment for you or not, because I don't know enough about what your health symptoms are. And the other comment I would make, I'm skeptical of dark field microscopy. There's no way for them to tell you for sure if what they're seeing under the microscope actually is Borrelia spirochetes or not. This is not recognized as a standardized way of checking to see if somebody has Lyme. So I'll just make that as a comment too. Okay. All right. Good luck to you. Bear with me here, everyone. All right, let's go back over here. Okay, let's see. Hello, Russ. Let's see. Do you ever see strange skin eruptions that come and go where the discharge is like a clear yellow like a honey? Also, what is a common infection that causes Blepharitis? Thank you. So I'm not sure about what you're describing with your skin. I would need to ask you a lot more questions to ascertain what you're talking about with that. Blepharitis is basically infection of the eyelids up in this area, generally thought to be due to bacteria that backs up into the oil pores and the glands up in that area. It probably, I can't tell you off the top of my head, but I would suspect it's going to be the common bacteria that lives on the skin, like various kinds of strep, maybe some staph. Those probably are what cause it. But I would have to look that up. I haven't looked into that for quite a while. All right. Thanks, Russ. Hello, Alex. Let's see. Can you test positive and high for mold toxins and show no symptoms? Do you still treat with binders, or do you only treat if symptoms are present, similar to Lyme? Let's talk about what you mean you test positive for mold toxins. Okay, so there again with or not again, but just so you know, there's two different ways that doctors are trained and will approach mold toxin illness. There are those that follow the teachings of Dr. Richie Shoemaker, and then there are those of us that don't follow that way. So let's talk about Dr. Richie Shoemaker's way. So Dr. Shoemaker is the first doctor that discovered this issue called mold toxicity. And people that are trained by him often will do blood testing to see if somebody has the genetic profile that sets them up to develop mold toxicity issues. And also they'll measure a bunch of inflammatory markers and chemicals that can be elevated to your blood if you have mold toxicity illness, but they never actually measure if you have the mold toxins in you. Okay, so the Shoemaker way of seeing if you have mold toxicity illness is to see if you have a chemical profile that looks like it, even without measuring the mold toxins. Now, the problem with the Shoemaker way is having a genetic predisposition does not mean you develop the problem. Number two, if you have elevated markers, sometimes those elevated markers can be elevated due to having Lyme in you. Okay, all right. Okay. The other way that I think is a better way, especially when people have Lyme disease, to measure if you have mold toxins is to actually do a urine test and see if you're peeing out large amounts of mold toxins. All right. And so that is a better way because it actually says, yeah, you got them in you. It isn't just measuring at the markers. Okay. So in terms of if you're saying you have high mold because you have the genetic profile or some of those increased inflammatory markers, well, the issue is they may be wrong. All right. And then in terms of whether you're peeing out the mold toxins, generally it depends what you mean by high. Okay. So I'm finding more and more these days, most of these labs like real-time labs and also Great Plains labs will start to say you have mold toxins in you if you're over a certain threshold. What I'm finding, though, is that I'm finding benefit in treating people if they're about 3 to 4 times or more above the threshold that says they're there. So in other words, most of us can tolerate a certain degree of mold toxins in us, and it's not going to cause us health problems. If it's not causing you health problems, I wouldn't treat it, okay? The other thing that can happen is any test that we do for any condition can have false positives. And your chances of having a false positive on a test increase if you have no symptoms of the illness. All right. So there's something in medicine we call a positive predictive value of a test. That's positive predictive value of the test. Okay. So the ability of a test when it's positive to truly indicate you have an illness is called the positive predictive value. All right. And if you have no symptoms of an illness, the positive predictive value of a test is next to 0. Okay. So it could be you got a false positive test going on here too. Why? I don't know, but it could be. Okay. So if you don't have symptoms of an illness, don't treat the illness. Don't rely just on a test. A test is just one clue of information, but it's not how we fully make a diagnosis. When we make diagnoses, we have to consider your symptoms, test, and risk that you could have gotten the condition, basically. Okay. All right. Good luck to you, Alex. Hello, Patsy. Hi, Dr. Ross. Do the pathogens that cause tick-borne relapsing fever create biofilms and have persister forms? If so, how long does it take to create a biofilm? Thanks for all you do. All right. So there has been no research done on the various forms of Borrelia that cause tick-borne relapsing fever to see if they cause persisters. There's no one that's done research suggesting that. That's not to say they can't. It's just we don't have research on that, okay? In terms of biofilms, again, no one has done research to suggest that these infections create biofilms. But we know most germs have the ability to create biofilms. All right, so biofilms, everyone, are a slime layer that germs will cover themselves in. And that slime is a sugar mucopolysaccharide slime, usually held together in a protein skeleton made up of blood-clotting protein called fibrin. And within a biofilm, there are a bunch of different kinds of bacteria that are not even related to like the Borrelia infection, but just microscopic bacteria that will live there. And there's a bunch of different functions these bacteria take on. These biofilms have waste channels. They have food intake channels. They're really complex structures, all right? And although I sometimes will focus on giving a person something specific for biofilm, if we look at a lot of research, just killing the germs that are making the biofilm often is enough for the biofilm to fall apart. Sometimes you don't even need to do anything specific for it, okay? All right. So for instance, Dr. Eva Chapi, who's a researcher in Lyme disease, about 10 years ago, published some studies, laboratory experiments looking at what it would, various antibiotics and their effect on biofilm. And I believe, if I'm right, I think tinidazole, for instance, can break down 70% of biofilm on, or 90% of biofilm on its own, actually, in her experiments, okay? And the herbs used together, banderol or cat's claw and otoba bark, which kill Lyme, also break up 100% of biofilm. So sometimes just being on antibiotics or antimicrobials is going to break up those biofilms, okay? All right. Thanks for the question, Patsy. Hello, Shelley. Let's see. I have a few questions around tick-borne relapsing fever. I hope you can answer. Does it hide in your system like Lyme disease? Is the bacteria only detectable in your blood while you have the fever? Is herxing an issue while being treated with antibiotics? Is the treatment 10 days with antibiotics or 4 to 8 weeks? I've read that symptoms lessen with each relapse and eventually you recover as your body develops immunity. Is this true? Thank you so much. Can't tell you how much I appreciate the information up here in Canada. The doctors don't seem to know enough about tick-borne relapsing fever. Well, I got to be honest with you. We now, it's a complicated illness, and it is one of those things that even Lyme doctors are just beginning to treat. We really didn't have good testing for it before we now do. We do think that in some people, tick-borne relapsing fever can lead to chronic illness, okay? And in situations where we have chronic illness, it can take, we use basically the same type of antibiotics we would use for Lyme, but it can take months or longer to get it under control in some people, okay? There are other people just doing a 1-month treatment with antibiotics is going to be enough to wipe it out. And I've seen it occur both ways, okay? So generally, if I've got somebody that has symptoms of tick-borne relapsing fever and they've had it for a while, and that means relapsing fevers, I'm usually going to try at least 30 days of antibiotics, have them back in and talk to them again. And if they happen to have a complex where their fevers go up every month, I might actually do 2 months of antibiotics, make sure I treat through at least 1 cycle or 2 cycles of those fevers. If it's somebody that has spiking temperatures every 7 to 10 days, well, you can follow those. And I treat long enough to make sure that the spiking temperatures are gone before I stop treating, okay? In terms of the way that we actually test for tick-borne relapsing fever, we're not actually measuring the bacteria in your blood, we're measuring your antibody reaction. So even after you treat, because your immune system makes antibodies that will persist even when germs are gone, those antibodies will still be there, okay? And so does it hide in your system? It likes to go into tissues of poor blood flow. And yes, it can become a chronic condition. Okay. Anyhow, those are my thoughts on it. All right. Good luck to you, Shelley. Hello, Dominic. Hi, Dr. Ross. I understand that a potential side effect of using activated charcoal for mold toxicity is hair loss. If this occurs, does hair growth go back to normal after you stop taking it, or is it permanent? So, Dominic, what happens with activated charcoal is it can remove some of the minerals that are needed. It will bind up minerals that are needed for hair growth, okay? So my experience is when I start seeing hair loss, I usually will put people on essential minerals or core minerals to put those back in. And often, even while we're using activated charcoal, the hair loss will stop. Okay. Now, in bad situations, I'll stop the activated charcoal and put them on the essential minerals, and everyone, or core minerals, and everyone that I have treated that way, their hair starts growing again. It's not a permanent condition. That's the people I've treated. Okay. All right. So for my core minerals product, I like using a product made by Research Nutritionals. Let me show that to you here real quick. All right. So this is Marty Ross MD supplements. This is where my patients get their supplements, and anyone can get their supplements here. So if you're looking for a source, or you're wondering what I use or I would recommend, because I know there's a lot of garbage products out there, I've done a good job trying to curate and find good quality products. You can find them here. Okay. So Research Nutritionals makes a product called Core Minerals. This is what I will put people on right here, okay? And the directions for this are, I think you're going to do 2 pills twice a day. Yeah, that's how I usually do it, is 2 pills twice a day, okay? But if you're wondering what core minerals would be or what are minerals, just look at this label right here, and you can see the various kind of minerals that can be replaced by this. And this is what I usually wind up using if I start having people with hair loss, 2 pills twice a day. Okay. All right. Thanks for the question, Dominic. Good luck to you. Hello, Ada. Let's see. Who do you refer to when it's out of your wheelhouse, such as Chagas, other than infectious disease doctor? Why do you prefer? Okay, so Ada, I would ask you to look at last week's webinar. You asked this question and I answered it there. Okay. All right. Good luck to you. Hello, Laura. Hi, Dr. Ross. Thank you so much for these webinars. Is it possible to have an immediate reaction to moldy books? What could that feel like, and what can I do to calm it down? Thank you. All right. So let's talk about mold, and this pertains to moldy books as well too. So there are 2 problems that people can have with mold. Number 1, you can have allergic reactions to the mold, okay? And if you're exposed to mold, that can trigger histamine release, and the histamine release can give you runny nose, stuffy nose, sometimes can give you severe brain fog, and even can make you really tired, okay? So that's mold allergy. That can occur quickly, okay? The other thing that can happen with mold issues is that when you're around mold, those mold release gases that we call toxins, okay? And you can breathe them in, and they get into your bloodstream through your lungs. And in there, then, in 25% of people, they actually get trapped and you can't get them out. And they set off an inflammatory process, okay? But that is something you usually aren't going to just suddenly react to immediately like you're describing. Rarely you can. But usually that's something that occurs more over time due to a building up of mold toxins. So when I see people that are more rapidly reactive to mold, I think of mold allergies as being the reaction that they would have. And so what I usually wind up doing is work to stabilize the type of allergy cells called mast cells where histamines are made. And one of the things that can stabilize them is the herb called quercetin. It's a 250 milligram pill. I usually have people take it as 2 pills 3 times a day. The other thing you could do is take one of the over-the-counter non-sedating antihistamines like Zyrtec and Allegra. They basically work to block histamines after they're released from the mast cells so that they don't bind to histamine receptors, basically, okay? But yeah, those are my thoughts on that. Good luck to you, Laura. Hello, Mosby. Let's see. Do you have any suggestions or recommendations for people to go for last resort hard cases? Sometimes I wonder if for some people, Lyme disease is just an opportunistic infection for someone who has some other underlying issues. So Mosby, I answered a question similar to this last week too. So it may have even been from you. You know, any Lyme doctor that manages chronic Lyme disease, the wheelhouse of things we consider is any type of illnesses that can give chronic fatiguing issues and myalgia and severe cognitive issues. All of us do. And we should be considering the whole realm of things in addition to Lyme or mold toxin illness that can give you those symptoms. So basically, anyone that deals in this symptom realm should be considering all the other possibilities as well, too. Okay? Good luck to you. So, you know, just because somebody tests positive for Lyme doesn't mean Lyme is the cause of their issues. All right. You always have to consider, is it something else? Okay. Hello, Carter. Let's see. Are there any mitochondrial options that are prescription? No, there are not any mitochondrial options that I'm aware of that are prescription. Trying to figure out what options are when a kind of time. And Carter, I think you also answered this one last week too. I'm not quite sure why I'm getting repeat questions here. Anyhow, so take a look at what I said last week, okay? Hello, TJ. Any of these infections likely to cause mouth breathing? Not that I'm aware of. Not that I have seen. Hello, Frank. Hi, Dr. Ross. Can amoxicillin plus erythromycin fight Bartonella? So no. Well, partly. So Bartonella is a bacteria that it can live inside of cells. So we need to use antibiotics that treat intracellular infections, okay? Amoxicillin treats things outside of cells. It doesn't do anything about bacteria inside of cells. So Frank, there are various antibiotics that work intracellularly, and what I'm going to do is share with you my article, but how do you treat Bartonella? Okay, so let me just do a quick screen share here. So take a look at my online Lyme guide and take a look in my infection treatment plan section here. Take a look at this article, my Bartonella treatment article called Kills Bartonella Brief Guide. The approaches in here use intracellular antibiotics, basically, okay? All right, good luck to you, Frank. Hello, Thomas. Does Babesia, Borrelia, or BART have any correlation to the new or full moon? You know, all I can say is that, yes, for some people with tick-borne illnesses, they will have some flaring up around moon cycles. As to why it happens, I don't know, okay? Hello, Gail. Let's see, after COVID, does hidden Lyme resurface? So it's really complicated to figure that question out. So when people have COVID, the main reason that they feel worse after COVID is that COVID triggers cytokine excess. And as many of you know, when you have Lyme disease, the reason you have most of your symptoms is that your immune system in trying to get rid of these infections manufactures too many chemicals called cytokines. Cytokines are good and bad. On the good side, the cytokines can turn your immune system on. But on the downside, if they make too many cytokines, it gives you brain fog, makes your body hurt, gives you fatigue, disturbs how your hormones work, gives you confusion, et cetera, et cetera. So Lyme symptoms are really excess cytokine symptoms. And COVID triggers an excess cytokine state, okay? All right. The problem is when somebody gets COVID, if they're not getting better, it could be long COVID, meaning they got something still continuing to contribute to their cytokine excess, or it's possible that Lyme can reactivate. And it's not an easy answer. This is something I have to consider with a number of my patients. And I can only make a determination after asking a lot of questions and trying to figure out, does this look the same way that Lyme did before? How is this different? And I give them options as to whether we might want to treat for Lyme again or not treat for Lyme again. I have to individualize it for each person. Unfortunately, there is not a good test that we can do that says Lyme resurfaced. None of the tests are 100% accurate for looking at that question. Okay. All right. Thanks for that question, Gail. So there's a number of people that are asking questions that I answered last week. So I'm just going to start, instead of posting them, I'm just going to be deleting them. So if I don't get to your question and you asked it last week, listen to last week's webinar. Okay. All right. Hello, Brandy. Do you ever see other opportunistic infections come up like Pseudomonas or staph or strep? And what do you use for them? Or are there any particular distinguishing symptoms for them? So, usually Pseudomonas or staph or strep will have specific problems that help us identify that that's what they are. In terms of the answer is yes, I would look for specific symptoms of those illnesses. None of those illnesses set up chronic health problems like Lyme does. Okay. All right. Thanks for the question, Brandy. Hello, Catherine. Let's see, I've been living with chronic rickettsia, spotted fever, and murine typhus since approximately 2017. I have been treated 3 times with high doses of antibiotics and I'm still symptomatic. Chronic inflammation in the head, neck, and shoulders, problems with my vision, memory, ability to concentrate, and to stay asleep, and rash on my lower legs. Can you please discuss the similarities and differences between Lyme and rickettsia and their treatment? And number 2, would you recommend that I try Otoba cat's claw for rickettsia? So they're both spirochetes. I mean, that's the one thing I would say. Generally, rickettsia is easier to get rid of than Lyme is. And generally, it's a short course of antibiotics and you're done. I'm saying generally, okay? But there are some people for which it can become chronic. And in those people, generally, I would use the same type of antibiotic approaches that I use to treat Lyme. In terms of whether the Otoba and cat's claw actually work, I honestly don't know. I haven't seen anyone do studies on it. I do think it's something to consider trying, and I have done that on some of my patients before. But the one patient I've tried it on is somebody that did not respond to it, nor has that person responded to antibiotics either. And so the trouble with rickettsia as well as Lyme, as you know, there's a certain subset of people that no matter what we try to kill the germs, we're just not able to make much headway on them. Okay? All right. Good luck to you, Catherine. Hello, Pakia. Let's see. I have H. pylori. My doctor really wants to treat it with triple antibiotic therapy. I don't have symptoms, and GI is actually pretty good as long as I supplement with betaine. Would you say no need to tackle H. pylori and chronic Lyme patients? Second question. I have macrocytic anemia for probably lifelong. Even with methylated B vitamins, eating red meat, and exercising, My red blood cell is low and MCV is always high. Iron ferritin is in normal range. Do you have recommendations for anemic patients? I think pre-existing anemia, low thyroid conditions exacerbate Lyme fatigue. All right, bear with me because you asked a number of questions here. Hold on just a minute. Okay. So a treatable form of macrocytic anemia is so the large red blood cells can be due to both vitamin B12, or folate deficiencies. Okay, iron deficiency gives you small size red blood cells. Now there are some people that the other thing that can give you a big blood cell separate from B12 and folate issues is alcohol can lead to large red blood cells as well too. But there are groups of people that there's a small subset of people that will make elevated size of your red blood cells that is not related to B6 or to B12 or folate. Okay, in other words, it just happens and we don't know why. All right. Could it be contributing to some of your fatigue? Well, it depends on how low your red blood cells actually are. And you haven't given me a number here, so I can't say for sure. Okay. Let's see. In terms of regarding your testing positive for H. pylori antibodies, just because you test positive for something does not necessarily mean you have the problem. It could be a false positive. This is something you should talk to your regular doctor about. But if I have a patient that has no symptoms of H. pylori and they were to test positive, I wouldn't treat it because it could be a false positive test. I think that answers your questions. All right. Good luck to you. Hello, Sandra. Hi, Dr. Ross. Which tick-borne infections cause burning foot soles, neuropathy in the forearms and calves? Which herbal combos address all forms? So the two infections that are commonly involved with neuropathy, which is what you're describing, burning is a symptom of neuropathy, and then you're saying you have neuropathy in your forearms and calves. So I usually will, the two that can cause that would be Bartonella and also could be Lyme, either one of those, okay? Now, to help you figure out whether you have Bartonella and whether you should treat it, I would want to know more than just do you have neuropathy. I would want to know more, do you have any of the other symptoms of Bartonella, like pain on the soles of the feet and near the balls of the feet that you can walk off as the morning goes on? Do you have any air hunger? Do you have any psych symptoms like ongoing anxiety or depression? Do you get tremors or shakes? Do you have a feeling of internal vibrating or buzzing? Do you have air hunger? I think I mentioned that earlier. Do you have any stretch mark rashes, for instance, that show up? And do you have any positive testing showing Bartonella too? Okay. So neuropathy by itself does not mean you have Bartonella. Just like neuropathy by itself does not mean that you have Lyme. But if you have enough symptoms suggesting Lyme and you have enough symptoms suggesting Bartonella, then treat for them, okay? And so which herbal I'll address all forms. So I would, as a starting place of how I start to treat Bartonella herbally and Lyme herbally, you could take a look at my Lyme disease treatment protocol. And in there, you'll see that I mentioned using cat's claw and otoba bark to treat growing Lyme. And then I like using liposomal cinnamon clove oregano oil capsules to treat persister forms of Lyme. They also treat persister forms of Bartonella. And then for growing Bartonella, I like to use Hutania and Sida acuta, okay? So let me just show you that. If you're wondering how I treat things, let me just do a quick screen share for you. All right, so back in my Lyme guide. So in terms of how do I approach things? So keep in mind, everyone, I know that you are asking me questions, but keep in mind, in this guide here, you probably could find a lot of these answers to the questions you're asking tonight, okay? So how do I approach Lyme and Bartonella? Well, take a look at my Lyme treatment protocol. And you're going to see over here on this side, you'll see there's a Lyme infection tab, there's a co-infections tab, and you could look through here and see what herbal combinations I usually start people on, okay? All right. Thanks for that question. Good luck to you. Hello, Denise. Let's see. Hi, Dr. Ross. My grandson, age 24, has been on Doxy for Lyme for about 3 months without much improvement. Neuro symptoms may be worse. And I'm thinking about doing cat's claw on Toba bark. Would you add the essential oils or biocidin or grapefruit seed extract to cover for persisters? So I'm going to make a comment and I'll answer your question specifically. So when you treat Lyme and you treat Bartonella and you treat Babesia, they each have different timelines over which the recovery can occur, okay? So for instance, for Bartonella, if you are on a combination of either herbs or prescription antibiotics that's working, you should start to see improvements, not be completely well, but see improvements in the symptoms of Bartonella by 1 to 2 months. For Babesia, you should also see improvements in Babesia symptoms if you're on something that's working by 1 to 2 months, okay? Now the Lyme, and so those respond fairly quickly, and the reason is they replicate fairly quickly. For instance, Bartonella replicates every 24 hours, okay? And things that grow more rapidly respond to treatment more quickly, all right? By comparison, Lyme replicates much more slowly. May replicate every 4 weeks to every 8 weeks, okay? So if we look at, there's been some studies done. There's been a non-published study that was presented maybe about, I think maybe 15 years ago or so now at one of the annual ILADS meetings, in which they looked at how quickly do people turn around, okay? And so what they saw in that study, they put everyone on clarithromycin and Flagyl. All right, so the clarithromycin would treat spirochete Lyme inside and outside the cells, and also the Flagyl would treat the cyst form of Lyme, okay? And what that study showed is that by 3 months of treatment, 30% of people started to improve, okay? So which means by 3 months of treating, 70% of people had not started to improve yet, okay? All right. And then by 6 months, 60% of people were improving. And by 9 months, 90% of people were improving, okay? So the reason I'm telling you this is that you should know that in the Lyme treatment, it may just take time, okay? All right? That also fits with a study that was done by LymeDisease.org. They have an ongoing project called My Lyme Data. And this is, I guess I have about maybe 14 or 15,000 people enrolled now. These are people with Lyme. And periodically, LymeDisease.org will ask them questions and publish the findings. So a couple of years ago now, they did a study looking at, or maybe 1 year ago though, they did a study looking at what is it that it took for people that were high responders or people that got all the way well to get well. And there were two major overriding factors in there. Number one, working with a Lyme literate medical doctor, okay? Number two was being on antibiotics for a long time. And this was a year or more, okay? It took time to get them well. That's what their study showed, okay? All right. All right, so I just wanted to make that comment, okay? So it doesn't surprise me that nothing is changing at 3 months. That's very typical when you're managing just the Lyme infection, okay? All right. Now, in my treatment approach, I try to have people on things that treat growing forms of Lyme and also treat persisters at the same time. So your cat's claw and a toba is going to treat growing Lyme. There's some recent research that came out that says cat's claw may even treat persister Lyme too. And that's studies that were published out of Johns Hopkins University within the last 12 months they were published, okay? And I also like to use liposomal cinnamon, clove, and oregano along with those two herbs to treat persisters at the same time. Okay. You can also combine that liposomal cinnamon, clove, oregano, 1 cap twice a day with prescription antibiotics if you're using those. And again, use them to treat persisters. Okay. Now, that's my approach. All right. I know that I've been hearing from some of my other Lyme colleagues, some of them aren't putting people on persister parts of the treatment until the end of treatment. And then they're using more of their persister agents at the end to wrap up treatment to make sure that they wipe out germs so they don't come back. I will tell you, no one's done studies to say whether my way is right or their way is right, okay? But my thinking is that as you use antibiotics, the antibiotics are going to pressure some of the germs to go into hibernation. Those are called persisters, all right? So I want to grab hold of those persisters while they're developing, and that's why I put people on anti-persister agents as part of their treatment early in the treatment, okay? All right. Good luck to you. Thank you for that question. Hello, Mary. Hi, Dr. Ross, and thank you. Once diagnosed, you're welcome. Let's see. Once diagnosed with with mast cell activation syndrome as a result of Babesia, Bartonella, and Lyme, will I always require antihistamines daily, even after aggressive treatment for tick-borne diseases? Probably not. Mast cell activation syndrome, everyone, is a situation where your mast cells, and mast cells are your allergy cells, okay? They're where histamines are made. Historically, we always thought these mast cells would make and release histamines in response to something allergic landing and attaching to them. Okay, your cat danders and your dog hair and your pollens, all that stuff landing on them, that they would then release their histamines. Okay, but we now know, based upon research of a number of people, that actually these mast cells get turned on by a number of things and more easily release their histamines, okay? And the number of things that turn them on include a variety of infections like Lyme, Bartonella, Babesia, mold toxicity can turn them on. Too many yeast in your intestines can turn them on, and stress. And in fact, stress is probably one of the number one determinants of turning on your mast cells, okay? All right, so don't forget to deal with stress if you have mast cell activation. What I have found in my practice, though, is that as we get the yeast under control, we get the tick-borne infections under control, we get the mold toxins out, that generally the mast cells quiet down, and usually I can get people off of their mast cell activation treatments as we're winding down, as they improve, basically. And in fact, many of them just treating the infections even before we get the treatment of their chronic Lyme and tick-borne illnesses done. Many of them we can get off of their mast cell treatments because just knocking down the germ load is going to be enough to stop triggering those mast cells to be active. Okay. All right. So I'm going to do a quick screen share here for a minute. So everyone, if you're wondering what is mast cell activation syndrome and what can you do about it, take a look in my immune system section here. And here's my article on mast cell activation syndrome. When do you think you might have it, and what to do about it, okay? Thanks for the question, Mary. Good luck to you. Hello, Kathy. Hold on here just a minute. Let's see, I was diagnosed with Lyme, Bartonella, Babesia in 2018 by a naturopathic doctor, but had to pause treatment several months in as I developed idiopathic urticaria that couldn't be resolved. I also developed frozen shoulder in my right arm. I found ways to control the hive outbreaks, and several months later, the right shoulder thawed.
I'm now following your Lyme protocol slowly and without large hive outbreaks, but now my left shoulder has frozen. Have your patients ever developed frozen shoulder during treatment? If so, was anything found to help alleviate the pain and get range of motion back? With all the other symptoms of Lyme, the frozen shoulder is currently the hardest to deal with. Thanks so much for all you do. I feel very fortunate that I found you. Well, thank you, Kathy. You know, one of the things, so I have an occasional patient that has frozen shoulder. I'm not sure that it's tick-borne related or not, okay, because I have no way of proving it is, but it could be. If you've ever had injury to your shoulder, you're going to have scar tissue in that area. And Lyme likes to live in scar tissue, all right? The reason it likes living in scar tissue doesn't have good blood flow. Lyme likes to get out of blood flow. It does not like to be near anything that has blood in it because blood has oxygen, and oxygen is toxic to Lyme, okay? So Lyme likes to get into places that don't have good blood flow. So it's possible that you could be seeing a flare, and maybe even from killing germs, you might be getting more inflammation where Lyme is living and is being killed. One of the things I like to do with my patients with frozen shoulders, as I'm treating, if it does seem to flare as part of treatment or even independent of it, one of the things that's useful is acupuncture. I like sending my patients that have these kinds of problems to acupuncture. Acupuncture often can do a good job of helping with this situation, okay? If you're needle phobic, look at seeing if you can find somebody that does Japanese style acupuncture. And if you are in the Seattle area, who I would recommend is a very good friend of mine that's a wonderful acupuncturist, a guy named Brandy Clare, C-L-E-R-E, who is a licensed acupuncturist in the Shoreline, okay? He does a remarkable job. He's helped me with a number of musculoskeletal problems I've had, and it's been magic, basically. But why Japanese style acupuncture is that they tend not to put the needle in deep and just get it in the skin. So it tends not to be as painful. And I'm a needle phobe, okay? So it tends not to be a painful way of doing acupuncture, all right? The other thing to look at with frozen shoulder would be physical therapy. You probably have tried that, but a lot of people forget to try the acupuncture, and acupuncture often can do a good job for this too, okay? All right. Good luck to you, Kathy. Oh, Kathy, with the hives that you are having, consider treating for some mast cell activation, okay? I would look at the article that I just showed everyone, but a basic treatment when you're looking at mast cells is to take something to stabilize your mast cells, all right? And to de-stress, all right? But a good mast cell stabilizer is quercetin, up to 500 milligrams 3 times a day. The other thing that's useful is something called luteolin, which is found in a product called Neuroprotect. It's 100 milligrams. And of that, I would do 1 pill 3 times a day on that one. Okay. All right. Those are 2 things I do together when I'm treating somebody that has mast cell activation and hive issues. Okay. All right. Let me just do a quick screen share here for you. All right. So again, my mast cell activation article, I would take a look at that. That's this one here. All right. I talk about the symptoms. I talk about what things you can do to deal with it. So beyond just being on mast cell stabilizers, take a look here, okay? But then in terms of the mast cell stabilizers that I was mentioning, take a look in my supplement store. Take a look in the, should have an immune system section here. All right, and I would take a look at the quercetin, which is this product here. That's the one I was just telling you about. And then I would also take a look at Neuroprotect, which is this one here. All right, and the Neuroprotect that you would want to do, that's this bottle, okay? I would do 1 pill 3 times a day on this product, okay? Now there's the Neuroprotect has a little bit of quercetin in it, but a very, very small amount. It's the main thing that's in here is the luteolin, all right? All right. Good luck to you, Kathy. Hello, Dave. Hello, Dr. Ross. Have you ever used or have read any literature of use? Nope. I already answered that one earlier. Hello, Denise. Also, question 2. What would you add to doxy to do a better job of getting the growing in cells and persisters? All right. So doxycycline, in terms of treating Lyme, is treating spirochete Lyme. And it gets inside of the spirochete and blocks protein production, but it also can treat intracellular Lyme, Lyme that moves inside of cells, and it does so by blocking protein production of the germ, okay? But for Lyme, you also have to be concerned about the cyst form of the germ, which is another growing form. And for that, I'd like to use grapefruit seed extract. It's a 250 milligram pill, 1 pill twice a day. And then in addition, I like using, as a starting point to deal with persisters, I like using liposomal cinnamon, clove, and oregano essentials, 1 capsule twice a day. Okay. All right. So those are kind of where I would start with that. All right. All right. Thanks for that question. And actually, Denise, I laid this out in my treatment protocol that I showed everyone earlier too. Okay. All right. Hello, Rich. Let's see. Hi, Dr. Ross. Is treatment the same for Babesia microti and Babesia decani? Thank you. You use the same things. It's just that we tend to think decani as being a 10-month infection to get rid of, versus Babesia microti is usually a 4 to 5 month. Okay, so it's a matter of length of time. But in terms of the things we use, I'm using the same things. Okay, all right. Thanks for the question, Rich.